Welcome to this informational webinar on AAACN's grants program. I am Margot Halm, nurse scientist for the association and chair of the research committee. We are thrilled to have the board of directors support of this new program to advance the science of our specialty.
And I'm Kristen Shear. I'm the co-chair for our research committee, and I'm also a nurse scientist, and I've been a nurse for over 18 years. And we want to thank you for taking the time to learn more about this new grants program, and we hope to see lots of proposals to help us advance the science of ambulatory care nursing.
The board of directors has recognized the significant need to strengthen our unique body of knowledge as a specialty. The AAACN strategic plan specifically calls out the need to build the science to achieve value and demonstration of health. The grants program represents a key strategy to support nurses and healthcare professionals in building the science that we need to demonstrate our value and lead needed changes in the ever-changing healthcare environment to ensure health for all. The new grants program supports both original research to build our science, as well as EBP and QI initiatives to translate that evidence into practice. For research, we will fund 3 projects, one each at the up to $5,000, $10,000, and $15,000 levels, with a total of $30,000 available for research. With EBP and QI, we will fund 2 projects, one each at the up to $2,500 and $5,000 levels, with a total of $7,500. Total financial support for this new program is $37,500. Here are the top ambulatory care nursing research priorities. These priorities were derived from our recent national study on ambulatory care nursing research priorities and the research committee scoping review led by Dr. Kristen Shear, my co-presenter, and also contributed by many AAACN volunteers. Thank you for your support of this work, as well as the AAACN strategic plan. We will discuss each of these in more detail after Kristen provides more context.
Thanks, Margot. So as we review these priorities in more detail, here are a few things to keep in mind. Each of these priorities are not mutually exclusive. We believe the strongest proposals are likely to support more than one priority. While we will heavily favor priorities listed in the call for proposals, you may choose to submit a proposal on a topic not highlighted. Your chances of getting funded will depend on the rigor of the proposal and how well you describe the importance of the gap your proposal is addressing. Any examples we mention are just that. They're meant to provide food for thought and an example of what might be considered a strong topic. We encourage you to be creative and clearly demonstrate how your proposal supports one or more of the priorities you see on the screen. While the research question or clinical problem must be the main driver of the proposed methods, we'll be favoring rigorous quantitative or mixed methods proposals, as there's quite a lot of descriptive and qualitative work already out there in the literature. Settings that represented some of the largest gaps from the scoping review were procedural centers, things like infusion centers and dialysis, urgent care, correctional facilities, K-12 school nursing, and community and home health. We know there are many of you out there working in these areas because you participated in our nursing priority study that Margot mentioned earlier. So we urge you to submit proposals that will address these gaps. If you came to the presentation on the scoping review at conference this past year, you heard me hammer how authors must do a better job of identifying our nurse types. So please be sure to explicitly call out the nurses that will be part of your project or study. Due to the overrepresentation of nurse practitioners in the literature compared with the proportion of the workforce that they make up within the US labor market specifically, we will also favor proposals that are focused on contributions of the registered nurse, the licensed practical or vocational nurse, or medical assistants. That means if 2 proposals are fairly even, we would choose to fund one that would be focused on RNs, LPNs, or MAs. But we invite everyone to think about these topics and how you may be able to help advance the science forward. So when we think about the category of person-centered care, the two most prevalent subcategories from the scoping review were patient-provider communication and patient education. This makes sense given the work that nurses often do in ambulatory care. However, you will also note that these are not listed as focus areas of interest. That doesn't mean you can't propose a communication or education related project or study. However, you will have to have a stronger proposal, or you will have a stronger proposal if you're linking the communication or education intervention to outcome measures, especially outcomes that fall into one of the focus areas listed here. Margot is going to provide some more examples.
Yeah, so some examples for person-centered care might include RN wellness visits to demonstrate the value of the registered nurse and patient-reported outcomes. Another example might focus on nurse-patient communication, such as motivational interviewing interventions to increase patient activation and engagement in healthy lifestyle behaviors, or health literacy interventions that test technologies and AI and the usability of health literacy-friendly informational materials. Another aspect that might focus on decision aids in advanced care planning. Some other examples that might fall under person-centered care could focus on tobacco cessation and substance use disorder interventions and the role and the impact of the registered nurse in these preventative areas, as well as the social determinants of health. As Kristen mentioned, there is quite a bit of descriptive information in the literature about SDOH, so we're really looking at more rigorous intervention studies. And then lastly, also want to call out holistic and integrative therapies such as yoga and mindfulness-based stress reduction for self-care or management of chronic conditions such as low back pain or migraines.
So the second priority is telehealth. Telehealth was one of the few silver linings to come out of COVID. However, according to a 2022 study and a recent industry report, levels of telehealth usage have been decreasing. Based on the scoping review, topics that are underrepresented in the literature within the realm of telehealth are remote monitoring, nurse advice line usage, and telephone triage. Again, the strongest proposals will link these interventions with outcomes.
So again, an example here might look at the effectiveness of remote monitoring and managing chronic conditions such as heart failure.
So for the third priority, we want to focus on the ambulatory nurse sensitive indicators. As of the time of this recording, the full updated 2024 NSI report is expected to be released in August. In the meantime, there is an executive summary available that outlines the contents of the new report to help you get started. If you haven't already looked at the summary, we'll put the link to that in our comments.
So some focus areas under this priority might be the impact of the registered nurse on improving nurse-sensitive conditions, such as the prevention of harmful falls in ambulatory settings, adverse events in ambulatory surgery settings, and hospital readmissions. Other ambulatory NSI topics might focus on screening with follow-up interventions for body mass index, hypertension, depression, suicide, and really the focus of those would be interventions to demonstrate, again, the value of the registered nurse in helping patients reduce their BMI, control their blood pressures, depressive symptoms, and suicidal ideation. And then another area might focus on care coordination in ambulatory settings or across the outpatient to inpatient settings to promote continuity of care and high quality care.
So the fourth priority is specialty population health. This priority is all about providing care to a defined group of individuals or target population. When you think about inclusion criteria for your proposal, if there's a defined group, perhaps older adults or those with XYZ acute condition, then this is a priority your proposal is addressing. Based on the scoping review results, studies about the role of the RN and the ability to drive improved outcomes for acute conditions are significantly underrepresented. This is especially an important gap when we think about the number of urgent care clinics you can see driving around most towns and cities, in addition to the urgent care services provided in many primary care clinics. Moving on to priority number 5, workforce development. While there were quite a few descriptive studies represented in the scoping review about pre-licensure education that described ambulatory clinical rotations or curriculum updates, more rigorous studies are needed. You've sensed the theme hopefully by now. The same can be said about continuing education and professional development. We're looking for proposals that will push the envelope and connect workforce development topics to outcomes.
So some focus areas related to workforce development might be nurse residencies for transition to practice of registered nurses and APRNs. And for those of you that attended the 2024 conference, there was a HRSA grants presentation, and you may want to access that recording to listen to it, as they really provided some model exemplars. Other examples here could focus on ambulatory clinical rotations and the use of simulation in pre-licensure education and professional development on key issues and topics.
So our final priority, priority 6, is leadership. When you first hear the word leadership, you might think of a position or in an organizational chart or my boss. You may also think about leadership behaviors within your work environment or organization. While these concepts are all part of the leadership priority, we're also looking for proposals that explore leadership as it applies to the practice and profession of nursing. This expands what we typically think of in an organizational context to now include things like political advocacy on issues integral to advancing the practice of ambulatory care nursing. One example from current events would be the push to change nurse reimbursement, currently being led by Rebecca Love.
So some focus areas under leadership might be healthy work environment initiatives that enhance staff well-being and reduce burnout, or incorporate meaningful recognition to improve nurse engagement and retention. Other examples might focus on workplace wellness initiatives that study the impact of building a healthy workforce, really on that healthy nurses, healthy nation concept. And then lastly, for organizational policy, studies on professional governance initiatives that demonstrate the value of the registered nurse in leading change locally in their own organization can help further support the Future of Nursing's 2020-2030 recommendations of nurses leading change. So now that we have described the top research priorities, now let's turn to what you need to know about eligibility. So there's 3 main categories of eligibility. The first one is AAACN membership. That is required for both the research PIs and lead investigators for EBP or QI proposals. In terms of licensure, an RN or NP license is also required for both grants, with the exception if the research PI is not a nurse, a co-investigator on the team must be an RN or an NP. And then for education, a master's or DNP is required for research proposals, but a PhD is preferred, or candidacy in a BSN to PhD or DNP program. For EBP and QI proposals, a BSN is required with a master's degree preferred. So now we're going to talk about the actual requirements for each type of proposal.
So first, looking to the research proposals, we're looking for a structured abstract. We want to make sure that you're clear and tell the reviewers how your proposal is supporting the priorities and how it will advance the science of ambulatory care nursing. If you're new to grant writing, we strongly encourage you to partner with a nurse scientist or other nurse who has experience in grantsmanship, who can help make your idea the best proposal possible. Also, please don't forget about the free research consultation that's offered through AAACN. We will also put a link to the consultation request in the comments. You'll also find when this proposal is live that you'll have an exemplar that can be referenced as you're building your own proposal. Here are those elements for the proposal in a little bit more detail. We are planning a future webinar that will go into these areas in much more detail for those new to grantsmanship. But briefly, here are the proposal requirements in a little bit more detail. In your background, please be sure to review what is known about your topic with recent sources. Identify the gap and finish this section with how you will address that gap. In the aim section, be specific and provide detail that helps the reviewers understand what you're going to do. Your theoretical framework should help tie your proposal together in a cohesive manner. As you write your method section, I'm going to give two seemingly contradictory recommendations. First, be as specific as possible so someone can easily understand how you're going to accomplish your aims. And two, be careful not to paint yourself in a corner by proposing something that you may not be able to accomplish in your setting, or with your budget or the team that you have available to you, and keep in mind the 1 year period of performance. Lastly, tell us how you're going to disseminate your findings. This doesn't need to be super long or detailed, but we want to be certain that all of this work is going to get out there and implemented in practice. So lastly, I want to point out that you may note the AMA format for references. This might seem a little bit odd at first, but was done because this style takes up far less space on the page for in-text citations compared with APA. If your proposal is going to be supported by another funding source, you'll notice under the budget form, we are still asking for a complete budget and for you to identify where the source is coming for each item. It's important to include this full budget so reviewers have confidence that you have thought through all the resources necessary to accomplish the study. If you aren't familiar with a personal statement, the NIH has some great resources on their website to help you develop this short piece of the proposal. Lastly, while you may not think about reporting guidelines until you get ready to write your manuscripts, it's important to reference them when planning to ensure you'll be able to adequately support every required reporting element for the study type you are proposing.
Okay, so let's move on to the EBP or QI proposal. These have similar requirements. A 250-word structured abstract is required. Your narrative needs to be double-spaced and cover the essential elements that are listed here under the narrative: your background and problem, your model, your aim, the evidence, the change in measures, outcome evaluation, timeline, dissemination, references, and personal statement. So all of those elements need to be adequately described in 10 pages or less. We will also have an example EBP proposal soon, just like the research example on our webpage. A non-research determination letter at the bottom here, the last element of the package, will also be required from your IRB. We understand that every facility may not have an IRB, so please do contact us so we can work with you to fulfill this requirement. As you are developing your EBP or QI proposal, be sure to fully explain the background of the problem, its significance, and why it needs to be solved. Next, describe your EBP or QI model that will be used as the overarching framework, followed by your aims and purpose. You'll also need to fully describe the evidence behind your proposed change and why you believe that it will work. And lastly, how you will measure the outcomes to determine the intervention's impact. A timeline and dissemination plan are other crucial elements of your proposal. Like the research proposals, AMA referencing will also allow you to number references consecutively, saving vital space for your narrative.
Before we move on to timeline, just briefly, if you are not familiar with AMA, we encourage you to look into different reference manager software. There are several available, free to use. You can look at EndNote, Mendeley. There are many others. We don't endorse any one, but that's, if you're new to AMA, may be something very helpful to you.
Thank you, Kristen. Okay, timeline. So as will be noted on the RFP, proposals will be due at 11:59 Eastern Time on October 1st, 2024. We anticipate sending letters of notification, either acceptance or non-acceptance, by early December of 2024. If awarded, funds will be released in January 2025. Projects must be completed within 1 year, with the exception of research grants. Research investigators may apply for a one-time, no-cost 1-year extension. I also want to point out that there is a 90-day grace period for IRB approval notifications. So funds will not be released until we receive that. So the 1-year mark will really start when your funds are released. Funded investigators for both research and EBP will be required to submit a final financial report and a project summary within 60 days of completion of the study or the project. Investigators are also expected to submit an abstract to the National AAACN conference as a poster or podium presentation. And of course, we'll also highly encourage investigators to submit their work to our new journal, the Journal of Ambulatory Care Nursing, as well as other journals, to reach the audiences that need to be aware of your important findings. So Kristen mentioned the research consultation service, and I want to take just a moment to show you how you can find this. We launched the service at the 2024 conference in Chicago, and to access it now, you can go to the AAACN website, click on About, and the drop-down menu comes, and then you can see under Leadership at the very bottom. If you click on Research, it will take you to our research webpage. Here you'll see Research Consultation Service right there in the middle of the research section. If you click on that, it will take you to the actual form that you will complete, and it will be submitted to the research committee, and one of us will follow up with you. So please do use this service and this way to get in touch with us, because we are more than happy to answer any of the questions that you have and to provide you with guidance.
You can also contact Margot or myself directly, and we want to thank you for taking the time to listen to this webinar, to read the request for proposals, and we're excited to see all the amazing ideas that you have.
Thank you.